If you're over 65, or you're caring for a parent who is, you've probably heard a dozen opinions about which medical tests are worth your time and which ones are outdated, unnecessary, or even risky. Maybe you've seen a video telling you exactly which checkups to skip. This one is different. I'm not here to tell you what to avoid. I'm here to walk you through the 5 tests that health organizations like the CDC and the U.S. Preventive Services Task Force consistently recommend for adults over 65, and more importantly, why each one matters at this stage of life. No fear tactics, no guilt trips about your health choices. Just clear, practical information so you can make informed decisions with your own doctor. Let's get into it. The first test on this list is bone density screening, and it's one that gets overlooked far more than it should. Most people associate bone density scans with women after menopause, and that's true. They are recommended for women starting around age 65. But bone density loss doesn't stop being relevant for men either. Men over 70 are increasingly encouraged to discuss this screening with their doctor, especially if they have risk factors like a family history of fractures, long-term steroid use, or a smaller body frame. The test itself is simple. It's called a DEXA scan. It takes about 10 to 20 minutes. You lie down, and a low-dose X-ray measures the density of your bones, usually at the hip and spine. There's no needle, no fasting required, nothing invasive at all. Why does this matter so much after 65? Because bone density naturally declines with age, and the risk isn't just about breaking a bone. It's about what happens after. A hip fracture in someone in their 70s or 80s can lead to a long hospital stay, a loss of independence, and in some cases, it can trigger a cascade of other health complications. Catching low bone density early gives you and your doctor time to act, whether that's through diet, weight-bearing exercise, medication, or simply adjusting your home to reduce fall risk. This isn't about scaring you into thinking every fall will break a hip. It's about understanding that a 5-minute scan every 1 to 2 years can give you real information instead of guesswork. The second test is a vision and eye health screening. And I want to be specific here because this is more than just checking if you need new reading glasses. After 65, your risk for 3 specific conditions goes up significantly: cataracts, glaucoma, and age-related macular degeneration. Each of these develops slowly, often without obvious symptoms in the early stages. That's the tricky part. You could be losing peripheral vision to glaucoma for years before you notice anything, because your brain is remarkably good at filling in the gaps. An annual comprehensive eye exam with an optometrist or ophthalmologist typically includes a check of your eye pressure, a look at the back of your eye through dilation, and standard vision tests. If you have diabetes, this becomes even more important because diabetic retinopathy is another condition that specifically affects the blood vessels in your eyes and is far more manageable when caught early. The reason this test lands on the always get this one list isn't just about preserving your ability to read or drive. Vision loss in older adults has been linked in research to higher fall risk and, over time, to reduced independence. Getting this checked annually is a small-time investment that protects a lot of your daily quality of life. The third test is a hearing evaluation, and this one deserves more attention than it typically gets, mostly because hearing loss creeps in so gradually that people often don't realize how much they've adapted around it. Maybe you've started turning the TV up a little more each year, or you find yourself nodding along in group conversations because catching every word feels like work. These are common signs, and they're worth mentioning to your doctor, not because they mean something is definitely wrong, but because an audiologist can measure your hearing objectively and rule things in or out. Here's what makes this particularly relevant for people over 65. Researchers, including groups behind the Lancet Commission's ongoing work on brain health, have found an association between untreated hearing loss and cognitive decline later in life. I want to be careful with that statement, because association is not the same as causation, and no credible study claims that hearing loss causes dementia. What the research suggests is more likely tied to reduced social engagement. When hearing becomes difficult, people tend to withdraw from conversations, avoid social settings, and that reduced social and mental stimulation may play a role in cognitive health over time. The takeaway isn't to panic about your hearing. It's to treat an annual hearing check the same way you treat a vision check, as basic maintenance, not a big deal, but one worth doing. The fourth test is a blood pressure and cardiovascular check, and I imagine most of you have already had this done more than once because it's fairly standard. But I want to explain why this specific test carries more weight after 65 than it did in your 40s or 50s. Blood vessels naturally stiffen with age, which is part of why blood pressure tends to climb even in people who've had normal readings their whole lives. High blood pressure, often called the silent condition because it usually has no symptoms, is one of the leading risk factors for stroke and heart disease in older adults. A basic check involves more than just the blood pressure cuff. Depending on your history, your doctor might also order a cholesterol panel, an EKG to check your heart's electrical activity, or discuss your risk factors for atrial fibrillation, an irregular heart rhythm that becomes more common with age and is linked to higher stroke risk. None of this means you're destined for heart problems just because you're getting older. It means these are inexpensive, low-effort tests that catch problems while they're still manageable through lifestyle changes or medication, rather than after a major event like a stroke has already occurred. The fifth test, and this is the one I think gets skipped the most out of discomfort rather than logic, is a cognitive health screening. I want to be really clear about what this actually is, because there's a lot of misunderstanding here. A cognitive screening is not a test that diagnoses dementia or Alzheimer's disease. It's a short set of questions and simple tasks, sometimes called a mini-cog or MOCA assessment, that gives your doctor a baseline for your memory and thinking skills. It usually takes less than 15 minutes. Why get this done annually if you feel completely fine? Because it establishes a baseline. If your cognitive scores are ever different a few years down the line, your doctor has something concrete to compare against, rather than relying purely on subjective impressions like, "You seem more forgetful lately." According to guidance from the National Institute on Aging, mild forgetfulness, like occasionally misplacing keys or blanking on a word, is a normal part of aging and is not the same as a sign of a serious condition. The screening exists to catch meaningful changes over time, not to label every senior moment as a red flag. If you're the kind of person who feels anxious about this test, talk to your doctor beforehand about what it actually involves. Most people walk away relieved at how low-key it is. Now, I want to address something directly because I think it matters more than the checklist itself. Getting these 5 tests done every year is not about assuming something is wrong with you. It's closer to how you'd treat regular maintenance on a car you plan to keep driving for a long time. You don't check the oil because you expect the engine to fail. You check it because catching a small issue early is always easier and cheaper than dealing with a big one later. The same logic applies here. And honestly, most of these appointments take less time than a haircut. I also want to touch on something that doesn't get talked about enough in these conversations, and that's the emotional side of getting older and facing more frequent doctor visits. It's common to feel a mix of things, maybe some anxiety about what a test might reveal, maybe some frustration at having yet another appointment on the calendar, or even some denial, a sense of, "I feel fine, why do I need this?" All of those reactions are completely normal, and if you're someone who avoids these checkups because the anxiety feels like too much, that's worth mentioning to your doctor too, or even to a therapist. Managing health-related anxiety is just as valid a reason to seek support as managing a physical symptom, and there's no shame in saying that appointments make you nervous. If you're watching this as a caregiver, whether that's for a parent, a spouse, or another older adult in your life, you play a bigger role in this than you might realize. A lot of people over 65 will downplay symptoms or skip appointments simply because they don't want to be a burden, or because they've convinced themselves that whatever they're noticing is just a normal part of getting older. Gently bringing up these 5 checkups, without pressure, and without turning it into a lecture, can make a real difference. Something as simple as saying, "I saw a video about this, want me to help schedule it," tends to land a lot better than, "You really need to go to the doctor." One more thing worth mentioning. None of these 5 tests are about guaranteeing you avoid disease or decline. There's no version of health screening that offers a guarantee, and anyone who tells you a specific test or supplement will prevent aging-related conditions entirely isn't giving you accurate information. What these tests do offer is information, and information gives you options. Early detection generally means more choices, less invasive treatment, and a better chance of maintaining your independence and quality of life for longer. That's a realistic goal, and it's a meaningful one. If you found this useful, the first video in this series covers checkups people often assume they need, but that current medical guidelines actually advise against, for most healthy adults over 65. So it's worth watching as a companion piece to this one. And if there's a specific test or health topic related to aging you want covered next, drop it in the comments. I read through them when planning future videos in this series. Before you go, a quick note. This video is meant to give you general health information based on publicly available guidelines from organizations like the CDC and the U.S. Preventive Services Task Force. It's not personal medical advice, and it can't account for your specific health history or risk factors. The right next step is always a conversation with your own doctor, who knows your history and can tell you which of these tests make the most sense for you and how often you actually need them. Thanks for watching, and I'll see you in the next one.